Hello, everyone. Today we have Dr. Liu with us. Dr. Kate Liu is a physician and research associate at King's College. She has a PhD in developmental psychology and specializes in child and adolescent psychiatry. Her full bio is underneath this video. And today we're here with Dr. Liu to talk about the study she recently published on JAMA on the long-term maternal and child outcomes following postnatal SSRI treatment. Thank you for being here with us today, Dr. Liu. Perfect. So I'm curious, obviously this is a very interesting topic at the moment. There's been a lot of changes in culture to do with postnatal depression. So I'm interested in what prompted you to investigate this topic.
Yeah, well, very happy to be here. And yeah, of course, because postnatal depression is actually very frequently affecting women after birth, after childbirth. So basically the prevalence rate is as high as 15% of the women may have this problem after giving birth. And if a postnatal depression happens, it can affect the women themselves and also affect their family and their children. So we think this is a very important topic to study, especially what will be the suitable treatment and the concerns about the treatment itself, or that, and we just wanted to know, like, treating postnatal depression with antidepressant, is it safe or is it risky or something? Is a basic question, but that needs to be answered.
Yeah, definitely. And what does the current guidelines say at the moment about the treatment of postnatal depression and maternal depression subsequently?
So it is agreed that postnatal depression should be treated promptly and appropriately. So the current guideline actually says that in the UK, of course, so treatments such as CBT, the cognitive behavior therapy, like talking therapy, and something like self-help CBT, and antidepressant, of course, those are recommended treatment for postnatal depression. However, the treatment consideration depends on a lot of factors. For example, the severity of the disease itself, and personal preference, and prior history of depression, or if there's any comorbidity or other mental health problems. So it's not like a very simple question to just say, oh, this should be treated in this way. And also, for example, and also the concerns about using medication during perinatal period, it's something that it's frequently brought up in clinic, and that worries, that concern can affect clinical decision being made. Yeah.
Okay, and so talk me through your study. Which population did you study and what outcomes did you choose to measure?
So our study used data from the Norwegian population, a Norwegian population-based cohort. It's called the Norwegian Mother, Father, and Child Cohort Study. So we use data, we use over 61,000 mothers and their children, the data from the MOBA, the Norwegian cohort. And we followed them up from pregnancy all the way to 5 years after childbirth. So basically that's the time frame of this study. And the study is ongoing. So there are more like new data coming every couple of years. So the cohort is ongoing. But for this study, we just use the data from pregnancy to age 5 years of the child. So, and our study looked at not only the maternal outcome, not only the maternal depression or their satisfaction of their relationship. More importantly, we follow the child outcome from birth to age 5. So for the child outcome, we look at their internalizing symptoms, externalizing symptoms, and their motor and language development. So basically look at their different aspects or different domains that we look at.
Okay, so that's really interesting, because not only did you look at the mother, but you looked at the relationship between the mother and the child, and then also subsequently how it affected the child. And so what
we look at the relationship between mothers and their partner, like the partner relationship.
Okay.
Yeah, that's reported by the mothers.
Okay.
Yeah.
Okay. And so what did you find in the study? What were the results?
Yeah, so basically, one thing that I want to emphasize about our study is because it is not a clinical trial, it is not like a randomized control trial. So we sort of need to control for the confounding that can affect our conclusion, or can affect the study findings. So we use an emulated trial design, which is sort of created a probability score that explain the exposure probability to postnatal SSRI.
Okay.
And then we control for that score in our analysis.
Yeah.
And in this way, we kind of try to account for all the potential other confounding factors that can affect the fact that the child is affected by the postnatal depression and the treatment. So this is kind of like the study design thing. And what we found is, very interestingly, we found that postnatal depression is associated with worse child outcomes. That's kind of proved over and over again by different studies. And postnatal depression is also associated with long-term maternal depressive symptoms or anxiety symptoms. And they also predict less satisfaction in their relationship. I mean, of the affected women. And what is interesting in our study is that we look at whether treating postnatal depression with postnatal SSRI can moderate this association that I just described. And we found that so treating the treatment with postnatal SSRI actually improve, just decrease the association between postnatal depression and those negative outcomes. So in a sense, kind of improve the outcome of those women and their child affected by postnatal depression, if that makes sense. And we want to also stress that we did not find any evidence suggesting treatment with SSRI will worsen the child development, like the motor and language development. We didn't see that moderation in our analysis.